Hi, my name is Drake Schiestel, and I'm a registered nurse and a family nurse practitioner student, and I'm going to be discussing the impact that full practice authority has for nurse practitioners in this Pecha Kucha, and what effect this could have in Arkansas, and why this would be important for the nurse practitioner's role in healthcare. First, I'm going to tell you about what full practice authority means, and according to the American Association of Nurse Practitioners, it's the ability for nurse practitioners to be able to evaluate, diagnose, and order tests and initiate and manage treatments, which includes prescribing medications under the exclusive authority of State Board of Nursing. This image captures each state in their practice environment. As you can see, Arkansas is highlighted yellow, indicating nurse practitioners have reduced practice. This means that the state practice and licensure laws in Arkansas reduce the ability for the nurse practitioners to engage in at least one element of practice, and they have to have a career-long regulated collaborative agreement with a healthcare provider. Nurse practitioners are sometimes seen as underqualified to provide full extent and quality of care. Some providers also have concerns that nurse practitioners haven't received enough education. However, nurse practitioners must meet many requirements, including educational and licensing requirements, and they must also meet national certification. They must also meet standards of care set by the State Board of Nursing. Under full practice authority, nurse practitioners are still required to consult and refer to other healthcare providers based on their patient's need. This allows the nurse practitioner to still remain accountable to their patients, the public, and the State Board of Nursing, which sets a high standard of care nationally. There are many impacts that nurse practitioners make on healthcare, and I'm going to discuss the impact that full practice authority could have in Arkansas for nurse practitioners and the effect that it would have on healthcare for communities all throughout Arkansas. This includes improving access to healthcare, improving delays in care, decreasing costs, and increasing job outlook. Full practice authority creates greater access to care, especially in underserved urban and rural areas. States with full practice authority are more likely for nurse practitioners to work in these areas, which creates improved access to care. This would be extremely beneficial for Arkansas due to having many rural areas that lack adequate health care services. By granting full practice authority, this would be improving efficient delivery of care. Patients would have direct access to the full scope of services that nurse practitioners have to offer, which would remove delays due to nurse practitioners being required to have physician oversight or collaboration. Full practice authority helps to avoid duplication of services and billing costs that are associated with outdated physician oversight of nurse practitioners' practice. Full practice authority helps reduce unnecessary repetition of orders, office visits, and other care services. Granting full practice authority would help improve the job outlook for many nurse practitioners. By increasing full practice authority, this would increase the demand of nurse practitioners and allow for many new opportunities within the nursing practice. Full practice authority allows the patient to see healthcare providers of their choice. Full practice authority would remove licensing restriction that often interferes with patient-centered care, and this would protect patient choice for which healthcare provider they would like to see. According to the U.S. Census Bureau, the aging population of 65 and over is increasing rapidly. This increases the need for health care within the geriatric population. This could potentially be a healthcare crisis due to the insufficient workforce that can't meet the supply and demand. Having nurse practitioners with full practice authority could easily help assist this disparity within healthcare. Arkansas has reduced practice authority, which includes disadvantages such as increased bureaucratic hurdles within the healthcare system, which reduces healthcare accessibility. This is also costing the healthcare system more money and decreases efficiency of care, especially in low-income populations. I spoke earlier how nurse practitioners in Arkansas have reduced practice authority. I'm asking for you to consider the benefits that full practice authority could have on the state of Arkansas and how many would benefit from this change. The Senate has recently approved legislation to grant certified nurse practitioners full and independent practice authority, which is one step closer to Arkansas obtaining full practice authority. Even though granting full and independent practice authority is one step closer to Arkansas obtaining full practice authority for nurse practitioners, it still places restriction on the nurse practitioner and requires for the nurse practitioner to practice under a collaborative agreement with the physician in order to earn the right to practice independently. Granting full practice authority has been an ongoing issue within the state of Arkansas. Fellow nurse practitioners and other associations have been advocating for full practice authority. A number of associations throughout the U.S. agree that nurse practitioners' full practice authority helps patients, physicians, and healthcare as a whole. According to the American Association of Nurse Practitioners, in more than 100 studies on care provided by both nurse practitioners and physicians, not a single study has found that nurse practitioners provide inferior services. In fact, these studies have shown that nurse practitioners have the same or better outcomes when compared to physicians. Nurse practitioners are equal providers within healthcare, and there should be no bureaucracy when it comes to providing patients with the best quality care. All healthcare professionals should work together and collaborate appropriately in order to practice to the best of their ability in the best interest of the patients. Nurse practitioners are prepared to give high-quality care through a combination of training and experience. Removing restrictions to the care that they provide will benefit patients, nurses, and healthcare as a whole. There are numerous benefits that can come from removing barriers that prevent nurse practitioners from full practice authority. As the data and research shows, when nurse practitioners have full practice authority, they are able to provide a greater service and perform their job better. The more that nurse practitioners are given more authority to practice, the more U.S. healthcare will benefit, and the more that the Arkansas community will benefit as well.